Good afternoon, friends. Today we are going to discuss about the mediastinum of the thorax. Okay, mediastinum in some other parts also there, but today we are going to discuss about the mediastinum of the thorax. And what is mediastinum? What are the subdivisions of the mediastinum? And what is its clinical importance? What are the structures which are present in the mediastinum? These are all very, very important clinically. Suppose if you take open heart surgery, where they are approaching, they are going into the mediastinum only. Or some other procedure, there are many procedures they are performing. Or suppose there is any problem with the esophagus, any problem with the trachea, and any problem with the aorta, and especially the descending thoracic aorta, all these things they are present in the mediastinum. That is why the mediastinum of the thorax, it is clinically it is very, very important. Because of this reason, you must know about the mediastinum. First, we proceed one by one. Okay. First, we take about the what is mediastinum. It is the thoracic mediastinum. It is a space. It is a space between the right and left pleural sacs. There are two pleural sacs. That is, one is the left pleural sac and one is the right pleural sac. In between these two pleural sacs, just like this. Okay, this is the right pleural sac. This is the left pleural sac. In between these two, this is the space. That space is called mediastinum. What are the boundaries? What are the limits of the mediastinum? That is, it is limited on each side by the pleura. That is, especially the mediastinal pleura. Already you know, pleura is also divided into different parts. That is posterior pleura, mediastinal pleura, like that. Okay, here the two on each side of the mediastinum, it is limited by a pleura. That is nothing but the mediastinal pleura. Mediastinal pleura, it limits the two sides of the mediastinum. And it extends from the thoracic inlet above to the diaphragm below. Above there is a thoracic inlet and below there is a diaphragm. Okay, from thoracic inlet up to the diaphragm, there is an extension of the mediastinum of the thorax. And in front by the sternum, that is three parts of the sternum, especially body of the sternum and mandibular sterni. And the side of the sternum, there are costal cartilages. Costal cartilages, that is the true ribs costal cartilages, they are reaching the sternum. They are also taking part in the formation of anterior boundary to the mediastinum. And behind, it is formed by thoracic vertebrae, especially bodies and intervertebral discs of the 12 thoracic vertebrae. 12 thoracic vertebrae. 12 thoracic vertebrae. In between these boundaries, there is a space that is called mediastinum. That is called mediastinum of the thorax. Mediastinum of the thorax. For our convenience, we are dividing the mediastinum for our study purpose. We are dividing the mediastinum into different segments. What are the different parts of the mediastinum we study? Okay. First, you see, this is the mediastinum here. This is the right pleural sac. This is the left pleural sac. In between these two, this one is the mediastinum. Okay. Here anteriorly is bounded by what? This is nothing but the sternum, and posteriorly by the vertebral body. That is from the T1 to T12. And in between the vertebral bodies, there is a disc, the connective tissue part, that is called intervertebral disc. These are all the structures they are taking part. And here, and this part of the pleura, we call it as mediastinal pleura. Mediastinal pleura. Okay. Okay. This is the space in the thorax, that is the mediastinum. Here you see, if you take the section in the mediastinum, these two are the lungs. This is one lung, this is the another lung, and this is the space in between the two pleural sacs. It is occupied by most important structures. That is the heart, pericardium, bronchus, trachea, pulmonary trunk, right and left pulmonary arteries, ascending aorta, arch of aorta, descending aorta, thoracic tract, esophagus. Okay, it is a very narrow space, but it is occupied by very important structures, and there are lymph nodes also. Okay, and nerves, that is vagus nerve, the next phrenic nerve, and venous plexus, nervous plexus. These are all the structures which are present in the mediastinum. That is why this mediastinum clinically also it is very, very important. Very, very important. Next, you see, these are the from anterior to posterior. From anterior to posterior, these are all the structures. This is the heart, and it is covered by pericardium, especially fibrous pericardium. Anterior to this is the anterior mediastinum, the part which is present in the covered fibrous pericardium plus heart and the roots of the great vessels. We call it as middle mediastinum, and this is the posterior mediastinum, and upper part is called superior mediastinum. You see here the subdivisions of the mediastinum. That is, first we divide the mediastinum into two parts. That is, upper one is the superior mediastinum, lower one is the inferior mediastinum. Okay, what is the demarcation point? That is, it is an imaginary line, imaginary horizontal plane. It is passing through the sternal angle anteriorly and posteriorly at the level of the lower border of the fourth thoracic vertebra. Lower border of the fourth thoracic vertebra. If you draw a horizontal line, that line divides the mediastinum into two parts. That is, upper one is the superior mediastinum, and inferior one, below one is the inferior mediastinum. Okay, clear? Superior mediastinum and inferior mediastinum. For our convenience, further we are dividing the inferior mediastinum into three parts. That is, one is the anterior mediastinum, next is the middle mediastinum, next is the posterior mediastinum. Okay, clear? And first mediastinum, it is a space between the two pleural sacs. It is bounded by, on both sides it is bounded by the mediastinal pleura. For our convenience, we are dividing the, that is, it extends from the thoracic inlet up to the superior surface of the diaphragm, especially the central tendon and some part of the diaphragm. Okay, and here this space, we are dividing this space into two parts. First, that is through a horizontal imaginary plane or imaginary line, where it passes, the imaginary line passes from the anteriorly from the sternal angle, that is at the level of the junction of the manubrium sterni and body of the sternum. It is also called angle of Lewis. Angle of Lewis, and this is the meeting point of the second rib. Second rib, from here to the posterior. From here to posterior. Posteriorly, the line passes through the lower border of the fourth thoracic vertebra. Body of the fourth thoracic vertebra divides the mediastinum broadly into two parts. That is, upper one is the superior mediastinum and lower one is the inferior mediastinum. Okay. Next, the inferior mediastinum. Again, for our convenience, we are dividing the inferior mediastinum into three parts. That is, the first anterior one is the anterior mediastinum, middle one is the middle mediastinum, and posterior one is the posterior mediastinum. Okay. You see here in this diagram, you can see here, this is the, okay, this is the thoracic inlet. This is the thoracic inlet, and this is the superior surface of, this is the thoraco-abdominal diaphragm. Okay, this is the superior surface of the thoracic diaphragm, and this is the thoracic inlet, and this is the sternum. Anteriorly, this is the sternum, and posteriorly by the T1 to T12. T1 to T12 thoracic vertebrae, and here this is the mediastinum. This total is the mediastinum. We are dividing the mediastinum into two parts by through a horizontal line. That is, this is the sternal angle, and this is the lower border of the T4. From here to here, if you draw a line through the mediastinum, the upper part in between the thoracic inlet and the horizontal plane, and anteriorly by the manubrium sterni, and posteriorly by the upper four thoracic vertebrae bodies and intervertebral discs. Okay, in between these boundaries, on both sides there is a pleural mediastinal pleura. In between these boundaries, this space is called superior mediastinum. Superior mediastinum. This is the superior mediastinum. And if you take below, that is below the imaginary plane, if you see further, this is the space, and this total space is called as inferior mediastinum. Inferior mediastinum. Okay. For our convenience, further we are dividing the inferior mediastinum into three parts. That is the first anterior one is the just behind the sternum and in front of the fibrous pericardium. This is the pericardial sac. This is the pericardial sac. Within the fibrous pericardial sac only, there is a heart. Okay. And outside the fibrous pericardial sac, just anterior to the fibrous pericardial sac and behind the sternum, here there is a thin space. Here there is a thin space. That space is called anterior mediastinum. Anterior mediastinum. And the fibrous pericardium along with the heart and roots of the great blood vessels, we call it as middle mediastinum. Middle mediastinum. And the part of the mediastinum posterior to the this one, that is posterior to the fibrous pericardium and posterior to the bifurcation of the trachea and posterior to the upper part of the arch of aorta. Okay, you see. Okay, this part of the mediastinum, we call it as posterior mediastinum. So it is clear. First is the superior mediastinum, inferior mediastinum. Inferior mediastinum, again it is divided into three parts. That is anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay, these are the subdivisions of the mediastinum. Okay, is clear? Next. First, we discuss about the superior mediastinum, about the in detail about the superior mediastinum. What are the structures which are present in the superior mediastinum, and what are the boundaries of the superior mediastinum? Okay, if first you see boundaries in front by the manubrium sterni. Already you know what is manubrium sterni. That is the upper part of the expanded part of the sternum. We call it as manubrium sterni. And behind by the bodies of the four thoracic vertebrae, intervertebral discs, anterior longitudinal ligament. Anterior longitudinal ligament. That is in front of the bodies of the thoracic vertebrae. There is a one ligament, a fibrous band, that is called anterior longitudinal ligament. Anterior longitudinal ligament. Next, above by the thoracic inlet and below by the horizontal plane. Horizontal plane, the plane it is passing through the sternal angular or angular fluis through the body of the fourth thoracic, lower part of the body of the fourth thoracic vertebra. And on each side by the mediastinal pleura. What are the boundaries of the superior mediastinum? Superior mediastinum clinically and in an examination point of view also is very, very important because there are important structures in the superior mediastinum. That is great blood vessels, especially arch of aorta and branches from the arch of aorta. That is the right side there is a brachiocephalic trunk, the left side there is a common carotid and subclavian arteries. Okay, and trachea and bifurcation of the trachea and thoracic tract, esophagus and phrenic nerve, vagus nerve. There are so many, and a mediastinal group of lymph nodes. That is also clinically very, very important. Because of this reason, superior mediastinum they routinely ask in our examination. Okay, they may ask for the essay question or they may ask for the short answers also. Okay, and apart from this, arch of aorta is also very, very important. Trachea they may ask. Okay, because of this reason, you must be very careful with the superior mediastinum. What are the boundaries of the superior mediastinum? In front by the manubrium sterni, that is the especially the posterior surface of the manubrium sterni, and behind by the bodies of the upper four thoracic vertebrae, intervening discs, and anterior longitudinal ligament. Above by the thoracic inlet, below by the horizontal plane, it is passing through the sternal angle to the lower border of the fourth thoracic body of the fourth thoracic vertebra. On each side, mediastinal pleura. Okay, next. You see here clearly. Okay, this part is the superior mediastinum, and this is the inferior mediastinum. Inferior mediastinum again it is divided into three parts. That is the anterior mediastinum. This is the fibrous pericardial sac, and this is the middle mediastinum, and this is the posterior mediastinum. Next, what are the contents of the middle mediastinum? This is very, very important. First, you take muscles. Okay, you remember like this, it is very easy to remember. Otherwise, you may confuse. Okay, that is why you take any region, what are the structures which are present in that region, you remember in order. Otherwise, you may confuse. It is very difficult because you know already anatomy itself is a dry subject. Is remembering all things, it is very difficult for us. Okay, because of this reason, you must remember in order. First, you take about the muscles. What are the muscles which are present in the superior mediastinum? That is first origins of the sternothyroid and sternohyoid muscles, and lower ends of the longus colli muscle. Longus colli. There is one muscle in the anterior part of the bodies of the thoracic vertebrae. There is a muscle that is called longus colli muscle. Longus colli muscle. That is, these are the three muscles. That is sternothyroid and sternohyoid. These sternothyroid and sternohyoid muscles, they are taking origin from the posterior surface of the manubrium sternum. Posterior surface of the manubrium sternum. That is sternothyroid and sternohyoid muscles. And they are going to the hyoid cartilage, hyoid bone. And this longus colli is a back muscle. Okay, just it is related with the anterior surface of the vertebral column. Okay. Next, these are the muscles. Next, coming to the arteries. Arteries. What are the arteries? That is, first one is the arch of aorta. Arch of aorta and brachiocephalic artery. That is in the right side. Right side, there is a first, there is a one trunk, common trunk. Then it divides into two. That is the common carotid and subclavian. Okay, but if you take the left side, there are two separate trunks from the arch of aorta. That is a left common carotid and left subclavian. Left common carotid and left subclavian. Okay, you see here, this is the arch of aorta. Okay, this part is small part is called ascending aorta, and then it continues as the arch of aorta. Then it continues as the descending aorta. Here, from the arch of aorta, there are three trunks. That is, this is the right brachiocephalic trunk, and the left side there are two. That is the common carotid and left common carotid and left subclavian. Left common carotid and left subclavian. Okay, these are the three important branches from the arch of aorta. Next, veins. What are the veins? That is the brachiocephalic veins and upper half of the superior vena cava, left highest intercostal vein. Here, the right and left brachiocephalic veins together they form the superior vena cava. Then the superior vena cava pierces the fibrous pericardium. Then it opens into it drains into the right atrium. Right? And here it also, there is a special vein, that is the left highest intercostal vein. It is also present, and it finally drains into the superior vena, brachiocephalic vein and superior vena cava. Finally, it drains into the right atrium. These are the veins. What are the veins? Brachiocephalic veins, that is right and left, and upper half of the superior vena cava. Superior vena cava before piercing the fibrous pericardium. And left highest intercostal vein. These are all the veins which are present in the superior mediastinum. Next, coming to the nerves, that is a vagus nerve, that is right and left vagus nerves, and cardiac nerves, that is these are the branches from the cardiac plexus, and superficial and deep cardiac plexus. Superficial and deep cardiac plexus is phrenic nerve, that is the nerve of the diaphragm, that is it takes the root value of the phrenic nerve is C3, C4, C5. It starts at the cervical level, but it supplies to the diaphragm. It is having long course through the thorax. Because of this reason, the phrenic nerve is also clinically, it is very, very important. Very, very important, because if there is any damage to the cervical part of the spinal cord, that is especially at the level of the C3 or C4, there are more chances for the paralysis of the phrenic nerve, and it may lead to paralysis of the diaphragm, and the person may die within minutes. Because of this reason, during road traffic accidents, especially in farmers, where lifting weights on the head, there is a more chances for the damage to the cervical part of the this vertebral column. It may lead to damage to the frenum. Okay, it also passes through the superior mediastinum and the left recurrent laryngeal nerve. Already you know, left recurrent laryngeal nerve. It is nothing but the branch from the vagus nerve. Vagus nerve, left recurrent laryngeal nerve. It is a branch from the vagus nerve. And then why it is called recurrent? It passes backwards, then upwards from the vagus nerve below the arch of aorta. Below the arch of aorta. That is why it is called left recurrent laryngeal nerve. This is also now which is present in the superior mediastinum. Next, trachea with the paratracheal and the tracheobronchial group of lymph nodes. Trachea and paratracheal, tracheobronchial group of lymph nodes. This is also clinically it is very important because trachea it is also called windpipe. Esophagus is a food pipe. Trachea is the windpipe. What is the length of the trachea? That is 10 to 11 centimeters. 10 to 11 centimeters. Where it starts, that is at the level of the C6. It is a common starting point for the both, that is esophagus and trachea. Anteriorly, there is a trachea. Posteriorly, there is a esophagus. The trachea continues down and it is having cartilaginous rings. Cartilaginous, C-shaped cartilaginous rings. C-shaped cartilaginous rings. C-shaped cartilaginous rings. They are made up of hyaline cartilage. They are made up of hyaline cartilage. And the trachea is having 16 to 20 cartilaginous rings. 16 to 20 cartilaginous rings. And the posterior part of this trachea, it is connected by a connective tissue and there is a trachealis muscle also. Trachealis muscle also present. And the cartilage, why it is made up of cartilaginous rings? No, why not bones? Because bones they need special blood vessels, but cartilages they don't need special blood vessels. They receive their nutrition from the surrounding tissue by the process of diffusion. By the process of diffusion, but bones needs special blood vessels. Okay, because of this reason. And at the same time, the tracheal rings, they prevent the collapse of the trachea because within the trachea, always there is a negative pressure. Always there is a negative pressure. If you want to prevent the collapse of this trachea and the principal bronchus and segmental bronchus, all these things, you must maintain if you want to maintain patency of the tract of the respiratory system, they must be provided with a specialized structure that is nothing but the hyaline cartilaginous rings. Hyaline cartilaginous rings. Okay, here it is starting from the C6. C6, that is the lower part of the larynx, continues as the trachea. Where it ends, the ending of the trachea in different individual, that is in the different age groups, in different level. That is, if you take the children's, the trachea ends at the level of the T3, at the level of the T3 by dividing into right and left principal bronchus. And if you take in the adults, in the erect posture, it may reach up to the level of the T6. It may reach up to the level of the T6. If you take in the cadavers, dead bodies, that is, usually it is at the level of the T4. That is at the level of the sternal angle. Okay, this variation in the tracheal level is very important clinically because if you take if there is any obstruction to the trachea, there is any obstruction to the trachea due to any growth or any foreign body or any due to sometimes the patients needs more days of artificial respiration. In that occasion, we go for the clinical procedure that is called tracheostomy. It is called tracheostomy. They make a hole in the trachea, then they pass the respiratory tube through that hole directly into the, not to the nose, not to the mouth, directly into the trachea in the neck. Then they connect to the artificial ventilation. That is nothing but the ventilators. Nowadays we are all discussing about the artificial ventilation, ventilators, oxygen, all these things because of the COVID. Okay, here the trachea, it is here during performing this tracheostomy, the tracheal position and relations are very important because there are two procedures. That is higher tracheostomy, lower tracheostomy. High tracheostomy and low tracheostomy. Usually in the low tracheostomy, you must be very careful because in the children, especially in the children, if you want to go for the tracheostomy, you must be very careful because the brachiocephalic veins of both the sides, they form the superior vena cava. Because in the children, they are in the higher level. Because the trachea divides at the level of the T3 only. Okay, because of this, above that level, there is this brachiocephalic veins. If you puncture or if you give incision at this level, the giphisternal fossa, okay, sorry, suprasternal fossa, and here it may cause damage to this brachiocephalic vessels, and it may produce alarming bleeding and may lead to death of the. That is why you must be very careful. And in adults, mostly less risky, but in children's low tracheostomy is highly risky, because of the presence of the blood vessels in close relation to the this trachea in the children's. Okay, and at the same time, the lumen of the trachea is also very, very important. That is usually the lumen size, that is 12 millimeters. The diameter of the lumen is 12 millimeters in the adults. But if you take the children's, the diameter is, if you add up to the age of the 3 years, the diameter is only 3 millimeters. Apart from that, after 3 years, there is an increase in the 1 millimeter to 1 year. Every year there is an increase in the 1 millimeter of the diameter of the trachea up to the age of 12 years. By the age of 12 years, the trachea reaches to the adult size. That is why the children's, especially pediatric practice, it is very important because you must know the size of the trachea. If you want to give artificial ventilation, if you want to pass a endotracheal tube, you must have an idea about what is the diameter of the trachea, what is the age of the patient. You must take into consideration the age of the student as patient. That is especially below the age of 12 years. And at the same time, the foreign body, if there is any aspiration of the foreign bodies into the trachea, there are more chances for the blockage of the trachea, and the person may die immediately. Especially it is more common in the children. It's more because of the small lumen of the trachea. That is the importance of the trachea. And there is at the bifurcation of the trachea. There is one point that is called carina. C-A-R-I-N-A, carina. And this is the highly sensitive point. Whenever any foreign material or any secretions of the lungs, if they touch this carina, it produces coughing reflex. It is a protective, last line of defensive mechanism. Last point of defensive mechanism to protect the respiratory pathway. That is carina. It is highly sensitive zone. That is at the bifurcation of the trachea. Next, coming to the esophagus. Esophagus is also a fibromuscular tube, or it is also called food pipe. It also starts at the C6 level and ends at in the abdomen. That is, madam, in the next class, madam will discuss in detail about the esophagus. Next is the thoracic duct. Thoracic duct is nothing but the lymphatic duct, and it starts in the abdomen at the level of the T12. That is nothing but the continuation of the cisterna chyli. That is nothing upward continuation of the cisterna chyli. It is beaded in appearance. The length of this thoracic duct is 38 to 45 centimeters. And the circumference or breadth is 0.5 centimeters. And it is a lymphatic duct. It drains most part of the trunk, especially except the upper part of the head and neck and superior surface of the liver, right lung. Except these, there is a special duct is there, that is right lymphatic duct. Except all these things, first it starts in the abdomen below the diaphragm. Then it pierces the diaphragm along with the aortic opening, along with the aortic opening of the diaphragm. Then it ascends in the posterior mediastinum, and then at the level of the T5, deviates from right to left. Then it goes up to the cervical level. Then it finally drains into the junction point of the left. There is a brachiocephalic and brachiocephalic veins. That is a subclavian vein and the left cephalic vein. The meeting point. It is the meeting point. Next, the remains of the thymus. As if you take the children's, that is, there may be the thymus is bulky, but after the puberty, up the age of the puberty, usually it atrophies. Only some fatty and fibrous tissue may be present. That is also content of the superior mediastinum. And lymph glands and lymph nodes. Lymph nodes is also very, very important in the mediastinum, because suppose if the person develops any malignant condition, cancers, or even tuberculosis also. Tuberculosis, it may be, it causes lymphadenopathy. It is nothing but the enlargement of the lymph nodes. Okay, because it is a limited space, these lymph nodes, they may cause compression over the structures which are present in the mediastinum, especially the tubes. That is, it may compress the trachea, or it may compress the esophagus, or it may compress the aorta, arch of aorta, descending aorta, they may be compressed. Okay, because of this reason, the mediastinal group of lymph nodes also clinically is very, very important. Next, anterior longitudinal ligament, that is nothing but the posterior mediastinum, that is just in front of the bodies of the, here at this level, bodies of the thoracic vertebrae, there is one ligament that is called anterior ligaments. Okay, these are all the structures which are present in the superior mediastinum. Next, coming to the inferior mediastinum. Inferior mediastinum, for our convenience, we are dividing the inferior mediastinum into three parts. That is anterior mediastinum, middle mediastinum, and posterior mediastinum. First, we discuss about the anterior mediastinum. What are the boundaries of the anterior mediastinum? That is, it is bounded laterally by the pleurae. That is the two right and left pleura, and posteriorly by the pericardium, and anteriorly by the posterior surface of the sternum. The left transversus thoracis muscle. There is from the sternum, there is one internal muscle. And fifth, sixth, and seventh left costal cartilages. Costal cartilage is also taking part in the formation of the anterior boundary to the anterior mediastinum. Okay, what are the contents of the anterior mediastinum? That is a loose areolar tissue and some lymphatic vessels, and that is they are draining the liver, and 2 or 3 anterior mediastinal group of lymph nodes. Anterior mediastinal lymph nodes, and the small mediastinal branches of the internal thoracic artery. Internal thoracic artery we are seen from the internal thoracic. It is a branch from the subclavian artery. Then it passes into the thorax, just anterior to the, just posterior to the, that is costal cartilages. And here also it is giving branches, intercostal arteries. That is branches from the, that is internal thoracic artery, and thymus gland. In adults also there is chances for the some amount of thymus gland, that is fibrous, in the fibrous form or in the fatty deposition. And superior inferior sternopericardial ligaments. In between the pericardium and the sternum, there are connections. They are called and superior and inferior. There are 4 pericardial ligaments. That is 2 superior sternopericardial ligaments, 2 inferior sternopericardial ligaments on both sides. This side one, this side one. Superior, inferior. Okay, they are also present in the anterior mediastinum. There is no much important structure in the anterior mediastinum. Only these structures are present in the anterior mediastinum. Next, coming to the middle mediastinum. This is the very, very important part, because this is the area it is providing accommodation to the heart and pericardium and the roots of the great vessels. vessels. Okay, here it is bounded by pericardial sac. It contains the vital organs and is classified into serous and fibrous. That is already you know. There is serous pericardium, fibrous pericardium, and serous pericardium. Again, it is divided into two parts. Are these things? Okay, next, what are the contents of the middle mediastinum? What are the structures comes under the middle mediastinum? That is, the first one is the heart enclosed in the pericardium. From the heart, there is an important blood vessel that is nothing but the from the left ventricle. There is a big great artery that is nothing but the ascending aorta and lower half of the superior vena cava. So already superior vena cava, you know, that is upper half of the superior vena cava. It is the content of the superior mediastinum, and the lower half of the inferior vena cava, it is the content of the middle mediastinum, especially after piercing the fibrous pericardium. After piercing the fibrous, the part of the superior vena cava within the pericardial sac. Within the pericardial sac, it comes under the content of the middle mediastinum. Outside the pericardial sac and upper part or superior part, we call it as content of the superior mediastinum. And along with this, there is a azygos vein. It also opens into the superior vena. Azygos vein. It also opens into the superior vena. And the bifurcation of the trachea into two principal bronchi. Two bronchi, that is right and left bronchi. The bifurcation of the trachea into right and left bronchi. That is also present in the middle mediastinum, not in the superior mediastinum. Trachea is present in the superior mediastinum, and bifurcation of trachea is in the middle mediastinum. You see here, this is the imaginary line. Okay, it is dividing the this is the superior mediastinum and this is the inferior mediastinum, and this part is called as anterior mediastinum, and this total one is the posterior middle mediastinum. Middle mediastinum. You see, this is the ascending aorta, this is the pulmonary trunk, and trachea. Here, this is the trachea and bifurcation of the trachea. Next, pulmonary trunk dividing into its two branches, that is right and left pulmonary arteries. Pulmonary trunk, it is starting point. It starts from the right ventricle. Starts from the right ventricle. That is ascending aorta starts from the left ventricle. Pulmonary trunk starts from the right ventricle. After that, it divides into two. That is right and left pulmonary arteries, and it goes to the corresponding lung. That is right pulmonary trunk goes to right lung, left one goes to the left lung. And right and left pulmonary veins. Pulmonary veins. Right and left pulmonary. There are four pulmonary veins. Right side there are two pulmonary veins. Left side there are two pulmonary veins. There are also contents of the middle mediastinum. Next, phrenic nerve. Phrenic nerve, it continues from the superior mediastinum, then it enters into the inferior mediastinum. Within the inferior mediastinum, it is the content of the middle mediastinum. Middle mediastinum. Then some bronchial group of lymph nodes. Bronchial group of lymph nodes. Here, the bronchial group of lymph nodes which are present in the middle mediastinum, they are the most commonly enlarged lymph nodes in the mediastinum, and they are most commonly they produce compression over the trachea or bronchus, and it leads to obstruction, and it may produce a difficulty in respiration. It produces a sound that is called stridor. It is called stridor. During respiration, it may produce sound, noisy respiration. Okay, usually during quiet breathing, there is no sound. But here, if there is any obstruction or any compression over the trachea or bronchus, it may lead to production of whistling voice or some sound that is called stridor. Okay, and pericardiaco-phrenic vessels. Pericardiaco-phrenic vessels. There are also contents of the middle mediastinum. Middle mediastinum. These are all the important structures which are present in the middle mediastinum. Next, coming to the another important part, that is a posterior mediastinum. Posterior mediastinum. What are the boundaries of the posterior mediastinum? That is anteriorly by the here the posterior mediastinum is long when compared with the other mediastinums, because it also extends below the level of the heart, because the diaphragm is like this. The diaphragm is not like this. Okay, diaphragm is like this. Posterior margin is like this. Okay, so the mediastinum, the posterior mediastinum, it extends down below the level of the liver, below the level of the heart. Okay, because of this it is long. Anteriorly from above downwards we see. what are the relations of, or what are the boundaries, what are the structures which are forming the anterior boundary to the posterior mediastinum from above downwards. That is first bifurcation of the trachea and pulmonary vessels. Bifurcation of the trachea and pulmonary vessels. See, this is the, at this level there is a bifurcation of the trachea. Then these are the pulmonary vessels. Then pericardium. Okay. Okay. Next is the fibrous pericardium and posterior sloping surface of the diaphragm. Posterior sloping surface of the diaphragm. You see, this is the diaphragm and this is the posterior sloping surface of the diaphragm. So you see, this is the anterior mediastinum. Up to here, this is the middle mediastinum. But this part is the posterior mediastinum. You see here, the posterior mediastinum, it is extending up to this level. Okay. Here, that is why this is first is the trachea, bifurcation of the trachea at this level, then pulmonary vessels, then fibrous pericardium, then posterior sloping surface of the diaphragm. Posterior sloping surface of the diaphragm. These are all the structures that are forming anterior boundary to the posterior mediastinum. Next, inferiorly by the thoracic surface of the diaphragm, or below. Below it is, the boundary is the thoracic surface of the diaphragm. And superiorly by the transverse thoracic plane. Transverse thoracic plane, that is the demarcation between the superior mediastinum and inferior mediastinum, that is horizontal plane. And posteriorly by the bodies of the vertebral column, especially the lower, that is below the level of the L4, below the T4, below the level of the 5th to 12th thoracic vertebrae and intervertebral discs. They are taking part in the formation of the posterior bone. And laterally by the mediastinal on either side, on both sides of this mediastinum, it is by the laterally by the mediastinal floor. Okay, mediastinal. In between these boundaries, there is a space. That space is called posterior mediastinum. Posterior mediastinum. Next, what are the contents of the posterior mediastinum? First, you take arteries. What are the arteries which are present in the posterior mediastinum? That is especially the descending part of the thoracic aorta. Descending part of the thoracic aorta. There is a ascending aorta, then arch of aorta, then it continues as the descending aorta. Descending aorta, it passes through the posterior mediastinum. Next, veins, azygos, hemiazygos, and accessory hemiazygos veins. Azygos system of veins already you know. Why they are called azygos? There is no corresponding artery. There are only veins. There is no azygos artery. Only veins are present. Okay, that is why there is no corresponding arteries. Because of this reason, they are called azygos system of veins. This also your examination point of view important to study. Okay, azygos vein and hemiazygos vein, accessory hemiazygos vein. That is azygos vein. It is formed in the right side. And hemiazygos vein and accessory hemiazygos vein, they form the left side. They ultimately they drain into the azygos vein. That is the hemiazygos vein drains in the upper part of the thoracic wall, posterior thoracic wall. Then it forms and it opens into the azygos vein at the level of the T7 by crossing the posterior mediastinum midline. Then the accessory hemiazygos vein drains in the lower part. Then it also crosses and it drains into the azygos vein. These are the structures, veins which are present in the posterior mediastinum. Next, nerves, that is vagus nerve, splanchnic nerves, sympathetic chain. Vagus nerve, splanchnic nerve, and sympathetic chain. Vagus nerves, there are right and left vagus nerves. That is 10th cranial nerve, and this is the very, very important nerve. And splanchnic nerves, that is the vagus nerves, they form the flexus. From the flexus, there are nerves, they are called splanchnic nerves. They are supplying to the intestines and parts of the gastrointestinal system. They are called splanchnic nerves. Next, the sympathetic chain on both sides, right and left sympathetic chains. They are also present in the posterior mediastinum. Next is the esophagus. Esophagus and thoracic duct. Esophagus, that is the length of the esophagus is 25 centimeters. Okay, it is having two constrictions. That is at the starting point, that is at the level of the C6. At the level of the C6, there is a constriction that is formed by cricopharyngeus muscle. Cricopharyngeus muscle, and it guards. And then at the ending of this esophagus, because it drains, it opens into the stomach. That is also, here also there is another constriction, that is cardiac sphincter. Called as cardiac sphincter. In between these two, let's say, sphincters, there is a tube, muscular tube, that is about 25 centimeters in length. And here it is also having narrowings. That is, there are 4 narrowing, that is the starting and at the ending, and in between there is a crossing the arch of aorta, and at the level of the bifurcation of the trachea, there are narrowings of the esophagus. They are all helpful for the clinically. They are helpful to identify the any foreign particle. If you swallow coins or some other particles, they may obstruct at the constrictions. That is why you must have an idea about the esophagus. Madam will discuss in next class or thereafter. They discuss about in detail about the esophagus. Next is the thoracic tract and some lymph glands. Okay, these are all the structures which are present in the posterior mediastinum. You see, these are all the structures in the posterior. This is the descending aorta, and this is the azaikos system of veins. This is the hemiazaikos vein. This is the accessory hemiazaikos vein, and these are all the intercostal arteries and veins. And this is the sympathetic chain. And these are the pulmonary veins, and this is the left principal bronchus. This is the pulmonary artery, left pulmonary. If you take the section at this level, this is the left pulmonary artery, and this is the arch of aorta. From the arch of aorta, these are the great blood vessels from the arch of aorta. Okay, so these are all the structures in the posterior mediastinum. So clear. So this mediastinum clinically also it is very important because many important structures, they are present in the mediastinum. Okay, because of this reason, you study in detail about the mediastinum. Okay, that is the mediastinum, and clinically and your examination point of view also it is very important. First, especially the superior mediastinum. What are the structures in the superior mediastinum? And in some books they may give that is the structures of the superior mediastinum. That is just retrosternal structures, intermediate structures, and posterior structures. Okay, whatever it may be, if it is convenient for you, you can remember like that. But better to have veins, arteries, muscles, nerves, like that. It is easy to remember, I think. But if it is convenient for you, you follow, no problem. Okay, but the superior mediastinum boundaries, contents are very important because clinically it is very important. And next is the middle mediastinum structures, that is the fibrous pericardium. Within the fibrous pericardium, there is a heart and great vessels, that is roots of the pulmonary trunk and ascending aorta and pulmonary veins, pulmonary arteries, bifurcation of the trachea, and especially the lymph nodes that are present in this area. That is, they are clinically they are very important because surrounding these lymph nodes there are important structures. That is ascending aorta, arch of aorta, descending part of the initial part of the descending aorta, and pulmonary trunk and pulmonary arteries, trachea, and branches of the trachea. That is right and left principal bronchus. Here, because of this reason, it is a junctional point. Very important junctional area. At this location, if there is any enlargement of the lymph nodes, you imagine what happens. It may compress. Suppose in some occasions, the lymph nodes they may reach. Usually, they are very difficult to find the lymph node in normal conditions. But if it enlarges, it may reach up to the size of the apple. Okay, if it occupies the size of the apple, what happens? Definitely it compresses over the surrounding structures. Depending upon the area structure compressed, it produces its own manifestation. Suppose if it compresses over the aorta, descending thoracic aorta, what happens? There is a turbulence of flow. Then, if at one point, what happens that the proximal part of the obstruction then it may get enlarged, and it may produce a clinical condition that is called aortic aneurysm. Aortic aneurysm, because of the compression over the descending thoracic aorta. Because there is no much space for the passage of blood, and it may lead to increased pressure in the arch of aorta, and it lead to the pressure condition that is called aortic aneurysm. Aneurysm means abnormal enlargement of the arteries. Abnormal enlargement of the arteries. Suppose it compresses over the trachea, it leads to ventilation problem. That is difficulty in respiration. Or sometimes it may produce stridor, sound. If it compresses the trachea, it produces sound. It is called stridor. Stridor means that is a noisy respiration. It is a whistling sound or some other sound is produced during respiration. Okay, because of this reason, or suppose if it may compress over some of the esophagus. Suppose if it is a compression over the esophagus, it may produce difficulty in swallowing, dysphagia. Okay, and the person is unable to swallow properly. Okay, and the esophageal cancers also very, very important because of the cancers of the esophagus, and tuberculosis of the lungs also. Tuberculosis of lung is the most common cause of the enlargement of the mediastinal group of lymph nodes. And taking a biopsy and studying about the mediastinal group of lymph nodes, it is a very troublesome procedure to the pathologists or the invasive diagnostic specialists. Okay, that is why you must be very careful with the superior mediastinum and the middle mediastinum and posterior mediastinum. That is the important structures. You study in detail about the thoracic tract, ajaga system of veins, esophagus, because these are all the structures that are present in the posterior mediastinum. And arch of aorta is also, they may ask for the 5 marks or essay question. And superior mediastinum is a very, very important. Okay. Okay, with this, conclude. Okay, thank you.